Treefort Music Fest is back for 5 epic days, 400 artists, and one unforgettable adventure in downtown Boise. From March 26th through the 30th, catch Sophie Tucker, Remy Wolf, the Linda Lindas, plus experience Alefort, Dragfort, and more. Tickets start as low as $90, so buy your pass now. And remember, zipline passes get you to the front of the line all weekend. Get your tickets now at treefortmusicfest.com/tickets. Today on CityCast Boise, Idaho's abortion ban is pushing doctors to the brink, and St. Luke says enough is enough. The hospital is taking a stand in court, challenging the laws it says puts patients' lives at risk. But why is it the only hospital system willing to take on this fight? We're digging into the legal battle, the community response, and the potential nationwide impact. It's Thursday, March 13th. I'm Lindsay Van Allen, and this is what Boise's talking about. Joining me today is National Reproductive Rights reporter from States Newsroom, Kelsey Mosley Morris. Thank you for joining me today, Kelsey.
Hey, thanks for having me.
And I wanted to have you on because there was a breaking piece that recently got published as a collaboration between ProPublica and States Newsroom about St. Luke's and about the fact that they are bringing a lawsuit against the state of Idaho and the state of Idaho's abortion ban. I wanted to talk to you about this because it's quite unusual for a hospital system to lead in a very politically charged lawsuit. So why has St. Luke's decided to take legal action against Idaho's abortion ban?
Yeah, it's very unusual. We actually couldn't really find any other instances of a hospital system taking this kind of action, especially when it comes to abortion. Usually hospital systems are the ones being sued or they're suing over some kind of business interest. And we kind of looked for, underlying motives that might be at hand here. Like we asked about business interests that might be something that they're protecting. But the real reason that everybody came up with was that this is about patient care and this is about protecting pregnant women and other people who can be pregnant. Universally have said that this is about emergency care and this is about protecting the community in general. They have been very careful about the injunction that is protecting them from prosecution for performing abortions in emergency situations because it's very costly to airlift people out of state and it's very disruptive to their lives. And one of the things that they stressed was that they have tried to be a very reliable hospital, and that means having a good track record for safety and for being a place where people can go to get reliable care. And this threatens that. So that seems to be the primary reason that they are continuing this lawsuit.
And what makes this lawsuit, besides the fact that a hospital is bringing it, what makes this lawsuit different from past abortion-related cases in Idaho and different from the lawsuit that Trump's Justice Department just dropped?
It's different from other lawsuits because of the plaintiff. There have been several lawsuits against Idaho's abortion bans, but they've all come from individuals, like individual pregnant people who have experienced complications and had to go out of state. They launched a lawsuit of their own in conjunction with some organizations, like advocacy organizations. Planned Parenthood has sued. There's been some teachers or like advocates who work with kids who are sometimes the victims of sexual assault, who have sued over the abortion trafficking law. But those were all, advocacy-based people and individuals and, people who have an individual stake in what's going on. There has not been an institution like St. Luke's, especially one that is such a big employer in the state and takes care of 41% of the babies delivered in Idaho as of last year. So the kind of influence that they have, it just makes them a more weighty plaintiff in this case. And it is largely the same as the lawsuit that the DOJ under the Biden administration, the Department of Justice under the Biden administration, put forward in 2022. It makes the same arguments that the federal law around emergency care mandates that you provide abortion as a treatment if that is what will stabilize the patient. But I think they have different standing because of the fact that they're a hospital system, they're a health system that takes care of a lot of people. And that's the only thing that really makes it different is that they are the ones with a majority stake in this issue, and they're the ones saying that we will be harmed by this if it is allowed to stand.
And can you clarify? There's been a lot of abortion ban laws passed in Idaho. Some of them are very complicated, very intricate. So with this lawsuit, how does the state's abortion ban conflict with the federal emergency requirements, or EMTALA?
So Idaho's abortion ban is pretty absolute. It's one of the most extreme in the country. It has more exceptions than some other bans that are in other states, but when it comes to the trafficking law in conjunction with it, it becomes one of the more extreme ones. And it applies to any stage of pregnancy. And there's also a civil enforcement law that allows people to sue doctors who might have to perform an abortion. So there is no caveat in there for preserving somebody's health in an emergency situation by terminating the pregnancy. So if somebody comes in with their water broken before a fetus is viable, then that can quickly progress to an infection. And if there is not an option available to end the pregnancy, then that can become a very deadly situation for the person. But what physicians have said is that it's difficult to determine when that point will be because there is an exception to save the pregnant person's life. But physicians don't know when that point will be crossed or when that point will be judged by a prosecutor as appropriate. It has to be a good faith judgment by the physician, but that's very vague. And especially in Idaho, I'm not putting words in the physician's mouth, but the Idaho Attorney General has been very upfront about his anti-abortion views and has kind of tried to have it both ways when it comes to saying that it's a good faith estimate of, when is appropriate to intervene, but also that there is never a scenario where abortion should be an option in these types of health conditions. So what EMTALA says, the federal law mandates that anybody who takes Medicare funding from the federal government has to provide stabilizing care if somebody shows up to an emergency room. And if that stabilizing care is an abortion, then it's really hard to say what a physician should do. And their position when it came to not being under protection of this law was to airlift people out of state to be on the safe side so that you didn't get to the point of becoming too septic to warrant terminating the pregnancy. So that's what they're saying, is that there's just this direct conflict between the two. If I could get sued under EMTALA for not providing stabilizing care, but I could also get sued under the abortion law and potentially have a lawsuit against me too, civil charges, then I don't know what to do. They're clearly in conflict with each other is what they're saying.
Yeah, and it seems like it potentially puts these emergency care physicians in kind of a double bind where you're damned if you do, you're damned if you don't. There's not a clear answer. So how has this political climate in Idaho influenced the way that hospitals operate?
There has been a lot of hesitation. One of the things that Dr. Jim Souza has talked about in briefings is before this law and before this whole issue started, if somebody came in with their water broken and they were starting to develop an infection, there would be no question about what they would do. And now it becomes a situation where they have to consult with lawyers for hours and try to determine what their next steps should be. And those delays in care is what they've said can lead to, worse outcomes. And doctors have talked about in the briefings the fact that they have been in situations already where somebody is progressing in their infection and they've had to wait until they felt comfortable intervening, but that becomes traumatic for the doctor and the patient who are suffering, and it just creates a lot of questions in their mind. And The one thing that Dr. Souza also mentioned was team dynamics, where there are people in the room when these decisions are getting made who you're not sure how they feel about abortion, and you're not sure if they would report you to the authorities if they disagreed with your decision. So that creates a rift in team dynamics. And so, this whole issue and the way that it has been nationally charged just heightens those hesitations and those fears for physicians.
This episode is brought to you by Prime Video. In the small town of Holland, Michigan, nothing is ever what it seems. Behind the tulip festivals and pretty houses lay dark secrets that threaten to tear a marriage apart. Nicole Kidman stars in this darkly twisted thriller about a wife and mother whose quest to uncover her husband's secrets may get her more than she bargained for. Holland, streaming on Prime Video March 27th.
Are your ulcerative colitis symptoms proving difficult to manage? Tremfya guselkumab can help you manage the cycle of UC symptoms. At 1 year, many patients taking Tremfya achieved clinical remission, and some patients also achieved endoscopic remission. Individual results may vary. Tremfya is a prescription medicine used to treat adults with moderately to severely active ulcerative colitis. Serious allergic reactions and increased risk of infections may occur. Before treatment, your doctor should check you for infections and TB. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Ask your doctor if Tremfya can help you manage the cycle of UC symptoms. Call 1-800-526-7736 to learn more, or visit tremfyaradio.com.
And I know we primarily focus on Idaho. This is CityCast Boise. But there are abortion bans all around the country. Why do you think that St. Luke's is the only hospital system in the entire country that is pushing back against these abortion bans?
Well, that's one of the reasons we wanted to highlight them is I don't really know the answers to that. But I think there is something to be said for the fact that a lot of hospital systems are owned by religiously affiliated organizations, and a lot of those are Catholic. And the traditional stance from the Catholic Church is that abortion is wrong in almost every circumstance. So they're not going to be the ones to take this on as an issue, usually, I would think. At least that's why there's some hesitation on their part, I would think. And there's also a lot of hospital systems that are owned by corporate interests and, places that are publicly traded, and that might have an effect on their bottom line. There's more risk involved in that. And St. Luke's is a nonprofit, non-religiously affiliated institution that has had these fights before that are ideologically at odds with the state. And so, I think they were in a position to be more comfortable with this than a lot of other hospital systems, I think, based on my own personal assessment.
And like you mentioned, St. Luke's over the past few years has taken controversial stances before. So how does this lawsuit compare to its fights during COVID and against Ammon Bundy?
It was interesting because when we went back and looked at quotes from those times, there were a lot of things that they said that were directly applicable to the same situation here, where they were talking about people during COVID who were ignoring health advice and, coming to the ER very sick, and they were overloaded by those patients and having to do things that were outside of their norm, things that they didn't feel very comfortable doing, things that might have threatened their medical license or, because they were forced to, like they had to change their procedures because of like how overrun they were with patients. And that's the same thing here, is people are afraid that they're losing their licenses and things that they're being forced to do because of these laws. And then when it came to Ammon Bundy, he is a right-wing, people like to call him a provocateur of sorts. He's constantly on social media, kind of just like provoking people into action over things that he's angry about. And one of those things was a child protection case that ended up at St. Luke's. one of the same years as a COVID surge, so they were dealing with these two things at the same time. And Bundy kind of got his followers to go protest outside of the hospital and put them in lockdown for a couple hours, I think, sending ambulances elsewhere, really affecting potentially a lot of emergency care and safety. His followers went after the hospital administration through email, accused them of being child traffickers and all sorts of terrible things. And they sued him, and they won like a $52 million judgment, I think it was, and ended up I think repossessing his house or seizing his house as an asset to help pay that judgment. And he fled the state and went down to Utah. He has filed for bankruptcy, and they're continuing to fight him in Utah bankruptcy court. So they have a track record of trying to hold people to account and trying to keep their hospital as safe as possible. And those two instances were very similar to what's going on now, and their motivations were very similar.
Yeah, Kelsey, it sounds like hospital systems generally around the country try not to take political stances, or they try to maintain a type of neutrality since they care for the entire community. So I'm curious, with them taking such a hard stance on this issue, how have Idahoans responded to this lawsuit? And has St. Luke's faced any community backlash?
It's interesting because I asked one of the doctors, Dr. Caitlin Gustafson, about any backlash that she might have received, because she's been very outspoken, and she is a family medicine obstetrician with St. Luke's. And she said she hasn't received all that much backlash from people, and a lot of it is more support. And I think that's one of the things that maybe is keeping them going, is the idea that this is something that's just supported by a lot of people. There's polling that shows people support health exceptions in the law, and they want to see that added, and legislators have chosen not to do it. So I think they feel like the people are with them on this issue, and that helps. I think they got a lot of backlash from the Bundy situation. They got a lot of backlash during COVID for vaccine issues. But on this one, I'm not sure that they're getting all that much flack from people. I think it's more grateful that they're willing to take it on and keep it going.
Something we've been talking about a lot on CityCast throughout the legislative session is there seems to be a recurring theme that people in Idaho don't necessarily feel like the legislators and the legislature in general are listening to them or listening to the concerns of Idahoans or the voice of Idahoans. Do you think that this lawsuit from one of the largest employers in the state, one of the largest medical systems in the state, could potentially act as a turning point for at least some parts of Idaho's abortion ban, that maybe if they're not listening to people, they will listen to what a business is saying, what one of the largest employers in the state is saying?
When it comes to the Idaho Attorney General, probably not. I think there's a lot of political tension between St. Luke's and some of the higher profile Republican politicians. I think because of that history that they have, it has become a political talking point when they didn't really want it to be. But I think it may become more of a sticking point than other issues, because it is about emergency care, and it is about something that seems straightforward to a lot of people. I think they are maybe going to be successful in making the argument that this is not about being pro or anti-abortion. This is about healthcare. And, people can say that about other aspects of the abortion debate as well, but they're not quite as compelling as this one, when it comes to somebody who has a wanted pregnancy, who is in a dangerous situation, who just needs care. This could be one of those situations where our abortion law must be clarified in a different way than other aspects.
How are other hospitals and healthcare systems reacting to this St. Luke's lawsuit?
I can say that I have talked to a few different physicians who were speaking mostly for themselves in other states. One of them was in Wisconsin, Wisconsin had an abortion ban for about 15 months that was basically in effect. And he said, Dr. Christopher Ford said they saw a lot of patients in the ER who came in with partial medication abortions that hadn't been completed, or, surgical abortions that they had complications with, and they were to the point of sepsis, and they were taking too long to seek care because they were afraid. And so he said, these types of lawsuits are important because we really need to get clarity on these things in the law to help people feel more comfortable seeking care when they need it. And there was also an aspect of this where they're worried about if this issue becomes one that they say an abortion law can override this federal law, what will they come for next? Will it be something about trans care or, religious objections, which the Idaho legislature is also already putting those in place. So it's kind of a slippery slope argument as well.
So Kelsey, could this lawsuit potentially impact abortion law around the country or create a national precedent?
Yeah, in Texas, there's been a similar fight over EMTALA. They were actually fighting to be able to be on the opposite side of this. The state was arguing that they should be able to have their state law override EMTALA. And there are 5 different states, I think, that have no health exception in their laws as well. So if they were to say that this does not apply, or this does apply to emergency abortion care and you need to airlift people out of state, then that will be a pretty seismic shift in healthcare for potentially those states without health exceptions as well.
So currently, right now, for any listeners who are wondering, if you are pregnant and having some kind of a pregnancy emergency, you can still get stabilizing treatment under EMTALA in Idaho.
Correct. As it stands right now, they are protected from prosecution as ER physicians in those situations.
Well, Kelsey, thank you so much. This is a really heavy topic. There's a lot to it. So thank you so much for taking the time to break it down for us.
Thank you. I appreciate it.
That's all for today here on CityCast Boise. If you enjoyed the show, make sure and leave us a review so other people in the Treasure Valley can find us. We'll be back tomorrow morning with our Friday News Roundup. You won't want to miss it.